Good afternoon and welcome to DB Active's session, information session with Sue Chow, the registered physiotherapist with Space Gym. And today we are talking about managing chronic pain as well as inflammation. Welcome, Sue.
Thank you, Sandra.
So, Sue, tell us a little bit about your process. Walk us through what is chronic pain? How will you manage chronic pain?
Okay, let me introduce myself first.
Sure,
okay,
please, go ahead.
I'm a registered physiotherapy in Hong Kong and trained in Hong Kong, and I have practiced in private sector for 18 years already. We have plenty of experience in management of the acute sports injury and as Andrew said, the chronic orthopedic pain. In our point of view, actually, there's a lot of way to tackle the pain problem in the world. But in our point of view, there's a very specific theory in the underlying reason of the chronic pain. There's altogether three problems together. The one is the superficial muscle adhesion. That means there's a lot of scar accumulation inside, and also the muscle layers are stuck together.
How does that usually happen?
Actually, it's due to the inflammation itself.
Okay.
Inflammation will happen in acute injury and also in the degeneration process. It depends on how it hurts. If you hurt it a lot, then the amount of inflammation fluid will secreted in a lot of amount, you know. But for the degeneration case, we will accumulate the adhesive fluid day by day. So that is the different expression of the pain. If you suffer from the acute injury, you will get a very severe pain in the days or in the months. But for the degeneration cases, actually you will feel the pain accumulated day by day and year by year. So that maybe say for the leg and shoulder problem, after you work for the computer work or the desktop work, static position,
in front of a monitor, which most of us are like.
Exactly. And very tense working environment, then you will suffer from a lot of wear and tear in the microscopically in the muscle fiber itself. So they will wear and then repair itself with the adhesive fluid we call the inflammation. But the inflammation itself is good for the repairment, but simultaneously it will adhere our muscle layers, so that for the healthy case, actually all the layers are separated and they can glide each other freely. But for the degenerated leg pain cases, we found that the layers, all the layers in the muscle fibers are heated together, and they stuck together and they can't glide each other, so that you will feel they are very stiff, and also you will feel it is very weak in the strength.
Okay, so from what I understand is that that adhesion is where we see muscles clumping up, and this is due to I guess static positions, continuous static positions doing X amount of activity. For example, on a keyboard, looking at a screen, and you're static.
Yes, that's right.
Typically, a lot of times you heard or you hear of what they call carpal tunnel syndrome, which is, I guess, part of that
Yeah,
this
yes.
condition, correct?
That's right, that's right. And you can find that there's a lot of paper or website will tell you why you suffer from such kind of degenerative cases or orthopedic pain. And you can find that the causes of pain including sports injury, improper forceful movement, repetitive movement or poor posture, and simply degeneration or getting old is the causes of
That's
the
kinda-
pain. but
Can't stop that.
actually, you may know that there's some anti-aging technology trying to stop the degeneration. But anyway, yeah, it's good to know. But anyway, I always tell our patients that there is some underlying reasons behind microscopically and anatomically, because as I said, the muscle fibers itself will heated. And the third one is very important because actually all our muscles got its own tracking. They will follow its own track to contract and relax. But if the muscles are heated so much, then they will shorten in length. So they will got a shortcut. Whenever
Clumped
the
together, because you ideally, from what I understand, I'm not, and just myself understanding how muscles work, because I do enjoy activity. So my understanding of it is that when you flex your muscles, it's supposed to be linear in the sense that it's like you said, in layers, and how you flex and contract affects your ability to have mobility, for one. That's why, for example, I can think of for runners, if you constantly run, you don't stretch, then correct me if I'm wrong, you create injuries that create tightness in the muscle or clumping of that. Is that what you're talking about?
Yes,
Okay.
but somehow I want to introduce the tracking concept to our audience, because actually for all muscles, they have their own tracking itself. But when the muscles got shortened or got a lot of scar inside, they will got a shortcut. And whenever the contraction go into the shortcut, you will feel the sharp pain.
So what do you mean by like shortcut? Because shortcuts are sometimes good, right?
Yes. Let me take an example.
Yes.
Whenever some worker, they lift up a heavy object,
Box on the
a
floor.
box, with a
Or
lot of
maybe
heavy
weights.
stuff, when they lift it and they suffer from a sharp pain, at that moment the muscle tracking malfunction. Actually, it's nothing about the prolapse intervertebral disc. Most of the cases about the wrong tracking
Is
in
that what they call
moment.
a pulled muscle? Like, you hear this all the time where somebody's lifting, or care for your back, you're gonna pull, you're gonna pull a muscle, or you're gonna sprain your back, or is that what it is?
Exactly. You will sprain it, but what I want to say is why you sprained it, because it go to the wrong track.
Okay.
That's what I want to say.
So
okay.
it's just like a train, right? If it's not on track, it'll crash.
Yeah,
Okay.
exactly, exactly the same meaning. And I would like to talk about another underlying reasons why we got the back pain. Actually, we all of us got deep spinal muscles, as the picture showed, the red one. Okay, but in two phenomenal papers show that when we suffer from back pain once, your deep spinal muscle will not repair itself and will be very slow response in the contraction. So the deep spinal muscles is for protection of our joint space, actually. But if you suffer from back pain once, then your deep spinal muscle will not function well. They will become
The reflex would be slower.
Yes, the
Slower
response
reflex.
will slow reflex, and also they will the electricity from the brain and the motor neuron will decrease a lot. So that actually
So the signal that your brain is
Yes.
sending to your muscles,
Yes,
it doesn't
yes.
go through as smooth as it would
yes,
if there
exactly.
wasn't an injury.
Yes, and the amount of the electricity will decrease a lot. So that actually the structure is still there, but they not function.
Okay, so obviously the next question is like, how do you fix that?
Yes. Okay. Okay.
Get to the point.
Okay, get to the one. Okay, but I would like to introduce the third problem first.
Okay, sure.
Okay. When you got the shortened superficial muscle and also the weakness of the deep spinal muscles, actually your joint space or your joint position will alter itself because the shortened muscle actually got a very huge tension to pull your joint aside. So all the so-called joint subluxation or dislocation clinically actually is from the superficial muscle tension. That's what I want to say. So when you treat the superficial muscle tension to the normal tension, then the altered joint position will be returned to the normal position
Okay, so-
itself.
What's an example of that?
Okay, I will show you.
Okay, great.
Okay. Essentially, as you asked, how we treat the these three problems. But before I told you how to fix it, actually all these three problems can apply to any kinds of joint in our body. Okay. Not only the spinal one, not only the leg, the back, is also about the joint, knee joint. You can see that.
So that's
a
is that
very,
bow leg, right?
yeah, bowling, yeah, and joint degeneration and deformity is due to the superficial muscle tension altered. Okay.
Huh. Is there anything you can do about that?
Yeah. And you can see the pictures when we got the normal biomechanics, your knee posture will keep in normal. But if your biomechanics are in disorder, then all the force will pull it outside, and the bow position,
bowling. Okay.
bowling, you know.
So how do you fix that? What do you do?
Yeah. Okay. And also the
for
pain,
runners.
the sole pain, the runners are
Runners.
Achilles tendon pain, right?
Yep.
Okay. So there's a lot of orthopedic pains from the superficial injury and the deformity itself. This is a common treatment. We will not
In Asia,
spend.
though.
We will not
Okay,
show
so
you
for-
because we are not common. We are different from
okay.
that kind of
Okay,
common
good.
treatment. Okay, we don't talk about the ordinary one. We just show you the our treatment. Why we different from the traditional one. Our treatment, we call it exotherapy. You can see that. For the effectiveness, our exotherapy treatment is ranked by our patient that they give a mark 9 to 10 out of 10. That means we can nearly completely cure their orthopedic pain. But for the traditional one, you can see that, and also for the effect sustainability, we can tell you that we can keep our patient in very good condition for 8 to 15 years. That means that they can long-lasting effect. They will got the long-lasting effect.
So
But,
it stays longer. So
yes,
I wanna
much
just,
more longer.
So I want to just draw a point around this, is that when we say traditional, that would
That is
effectively
true.
mean typical Chinese.
Not only Chinese one, it's also the ordinary physiotherapy.
Oh, okay.
That means the traction, the electrotherapy, ultrasound,
Yes.
shock wave,
Yeah, I did all
something
of
like
it.
that. Yeah,
I did it on my
yeah. Yes, they are. We call the traditional one.
Okay.
I will
So you're
introduce.
saying that the exotherapy it has a it has longevity if done properly.
Yes, that's right. And the time cost is much lesser than the original one. Okay. So let me introduce what is exotherapy. Exotherapy one is we have an exclusive technique and with the negative pressurized muscle massage to separate your muscle layers section by section and layer by layer. That means we will roll up the first layer and then the second one and the third one.
Wow, that sounds painful.
It doesn't painful, but you will feel some dull ache inside if
Okay.
you got the pain, actually severe pain.
Right.
You will feel some dull ache during the treatment, but it is bearable
Okay.
for a lot of patients. Okay, this is a technique for the first course. That means the superficial adhesion. Okay, when we do the exotherapy, we can separate all the adhered layer and soften all the muscle scar inside. And also the wrong tracking problem will also be solved when because we can lengthen the muscles and soften the muscle. All the tension in your leg or back or even the knee will be released in all, actually in all. So
Gradually. Going
gradually, section by section. Maybe talking about depends on the years, how long you
you've been
accumulated.
injured.
Yeah, yes,
Because
exactly.
as you mentioned, the longer you
Yeah.
build up,
Yeah.
if
Yeah.
you got hurt yesterday versus
Yes.
you got hurt 10 years ago.
10 years ago, that means this is directional, directly proportional. Okay, so for a 10 years case, I mean for a patient who suffer from the orthopedic pain for 10 years, it's talking about 24 to 30 section, they will get a complete recovery result.
So depending on the
time.
the
So
the severity,
that's right.
you will it can take anywhere between 30 to 40 sessions to get it over with, and each session is what, 14 minutes.
14 minutes? Yes, that's right.
So what is that?
That's the technique.
It sounds okay. So
It's a miracle,
so
right?
if you're doing it layer by layer, and these are obviously deep, these are deep tissue. How does that work? I mean, is it a machine? Is it a
That, of course, is a machine.
Okay.
That's the machine and the illustration how it works, because they suck it up, suck your skin
so
up.
there's like a section that they kind of
Yes.
pull your
Yes, yes.
your skin up
Yeah,
a little.
a little bit, and then roll it apart.
Oh,
Yes, this is the hardware technology is like this, and the software is our own application in our center. Okay, and also when we talk about the deep spinal muscle weakness, we will introduce another kind of exotherapy.
that was a
It's
video
called.
game.
Yes, it's a. Actually, this machine generates a challenging exercise environment to you. It's challenging your balance. You can see the platform, it will rotate itself. And also, simultaneously, you need to control your output. That means your pulling force or pushing force for in a precise and accurate amount to hold the light
To
in the machine
stabilize.
to stabilize and to control, to coordinate and your force itself. So in this environment, your balance and your eye-hand coordination will be challenged simultaneously. That means your cerebellum itself will be challenged. And the cerebellum is the control center for the deep spinal muscles. So Huber, this is called Huber the machine, actually stimulating your cerebellum and so as stimulating your deep spinal muscle.
Okay.
So after 12 to 16 sections, together with the exotherapy one, all the deep spinal muscle, which is weak before, will be strengthened to the normal position, normal function, and normal strength. Yes, that's.
Well, you'll
that's
try
why.
to get back to where it was before injury as best as possible based on these treatments, right? So how long does Hubert take?
14 minutes.
Another 14 minutes, so all
Another
in all
14
28 minutes.
Yes. No. Each section, 40 minutes only.
40 minutes.
40 minutes
Okay.
only. 40 minutes only. So we will design the program for all our patients. Maybe the 40 minutes will spend all for the exotherapy one. Maybe in a certain stage of the
so-
rehabilitation,
okay, so
we will progress
you
to
will
the
tailor
Huber.
it to
Yeah,
the
yes,
condition.
tailor-made all the
program.
for them.
Okay.
They don't need to worry about the program itself. So
Good,
That's
terrific.
very-
Thank you so much for
Yeah.
going through that.
Yeah.
I know about this because I had a snowboard accident when I was a kid. And I went to a physiotherapist, and effectively that's what it is. And that's why I know that. And what they explained to me was is that my muscle fibers weren't like this. They were like this. They were mangled up. So in order for that, in order for the muscles to function properly, they need to do what they at the time a deep tissue massage, where they kind of push the muscles to kind of back into track, as it were, back into this formation. And it didn't feel good. It actually hurt a lot. So I mean, from that my own experience, how does this exotherapy fare in terms of the pain scale? How does it hurt less? Does it hurt more than a deep tissue massage with your fingers or?
This is a more advanced technology in medical sector. So they actually, you know, that the advancement in the technology will provide some comfort to the patient, right? So with this technology, our patient only suffer from less treatment pain, but with a lot of treatment effect.
Wow. Okay.
And that's some, okay, I don't want to spend so much time on selling myself, ourselves, right? But I want to show you some example clinically, because we take the X-ray before and after. And also you can see that this kind of technology is quite popular in France. And you can see the famous French football player, Zidane, also used this kind of technique for the sports rehabilitation. Okay. Okay. This is a very interesting. I showed you two case studies. This is a 5-year-old girl suffer from a very severe leg pain after a car accident, because whiplash, and also the sudden break in a minibus, and the hit the head
on the
and
chair.
the front chair.
Seat in front.
Yes, and you can see that before the treatment, all the leg. The cervical joint are altered, and normally, actually, there's a normal
That's the
curve
neck,
in
right? That's the
that's the
C3,
neck.
4, and 5,
Yeah,
right?
C3, C3, C4, C5.
So your
and
neck
you-
muscles right
Yeah,
here.
yeah. The neck muscles.
Oh, sorry,
is
no,
here.
the neck-
neck
your
muscles is
vertebra.
here. Yeah,
Your
yeah.
neck- yeah, your
the
neck
neck
bones.
muscles here.
Yeah.
And the normal curve is like this, but it got a reverse curve in
Okay.
this kind of injury. And after 20 sections only, they recover to the normal curve, and all the pain gone.
Wow.
You can see that the girl said to us the pain level is 10 out of 10 before the treatment. But after 20 sections, there's no pain at all. And this girl suffered from a very bad posture in doing homework, and it will so-called adjust her own neck with the rigorous movement like this.
Oh, okay, you
know?
snap your neck.
Yeah. They always do that. So her parents think it's not correct, right?
It's not
so,
normal. Well,
so trying to consult a lot of doctors, medical doctors, orthopedic doctors, and they can't find any reasons why they suffer from like this. Okay.
I'll tell you a joke. I'll let you finish first.
Okay, but we found the reasons and also treat the problems. So after 20 sections, know the slap of her leg
She
and
wasn't
also the
cracking
pressure. Yeah. That's
So
all.
the reason is too much homework.
Actually, it's from the car accident. Okay.
And obviously,
also,
if you get in a car accident and when your neck is not in good shape, and we all know that if you're, doing your homework or even at your desk, you have a tendency to bend your neck, and obviously that doesn't make anything.
Yes,
it
that's right.
may not be beneficial
yes,
if you had
that's
an
right.
injury
Yeah,
or you're
yes.
recovering from an injury.
She already suffered from the whiplash, as you said, but the heavy homework workload will make it even worse.
Yes.
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 And this is another case. Suffer from also the leg pain. Leg pain is quite easy for comparison, because you can see the X-ray before and after. You can still also find that this middle-aged lady also suffered from a reverse lordosis in her leg, but after 30 sections, the normal lordosis curve has retained, and also for the pain level, before is 8 out of 10, after is 0 out of 10.
And obviously, this is subjective. That scale level is subjective, but it really
Subjective.
reflects
Yeah.
the person's how they feel
Yes.
at the time. Yeah?
Actually, for pain case, we quite focus at the subjective marking,
Yeah.
right? But for the objective one, the X-ray
X-ray proof it shows at the very
proof
least
that,
there it has,
yeah.
in terms of the alignment.
Yes, that's right. That's
It's
right.
there.
Yeah. So this is a very powerful evidence that exotherapy actually treating all kind of orthopedic pain in a very effective way compared with the traditional one or ordinary one. That's what we want to say.
Thank
today.
you very much, Sue. I think that's very informative.
Yeah.
I mean, we can't do without new technology, and if there's technology that can help you with chronic pain, that could be something that you invest some time into researching. So thanks again, Sue, for coming in. Sue's the registered physiotherapist at Space Gym in ICC. So for those who are members or would like to join Space Gym, feel free to let me know or DB Active know to connect you with Space Gym so you can find out more information. Thank you again.
Thank you.